Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Choa.
My name is Leslie Owens. I'm first and foremost a mom, and I'm also a registered nurse, and I'm a lactation consultant, IBCLC. And I run a private practice where I help moms and babies with breastfeeding and have a lot of experience personally and professionally when it comes to breastfeeding.
Thank you for joining us today. I'm so excited to hear about your story, your journey, and what keeps you motivated in doing what you're doing. I want to start off by just asking you how you got into what you're doing. When did you become a lactation consultant and why?
So ironically, the way that I got into doing what I'm doing is that my own personal breastfeeding journey, but I think the ironic part about it was I'm a very stubborn person. And whenever my oldest son, who is 15, was born, I really didn't get very much support when it came to breastfeeding. And it was really important to me because of the health benefits. And I'd read so much about it, and it was really important to me to have the bond and all those things. And I was getting a lot of resistance from my family, especially the women in my family. And they were all well-meaning, but they were thinking like, oh, if he cries a lot, it's because he's hungry. He's not getting enough, or there's something wrong with your milk, which really just kind of agitated me because me being a nurse, I wasn't in lactation then, but I knew I'd read enough and I knew enough to know that as far as I knew, everything was going well. But it just really made me more and more determined. So that stubbornness and that determinedness, that made me go on to breastfeed him for a very long time. He nursed until he was 2. And I think the ultimate kind of like, I told you so, like I can do this and, and I'm going to do this. And you can't tell me different was that I went on to actually become a lactation consultant because that drove me to want to support other mothers who need the support that they may not be getting from their environment.
In your family, did you see other women breastfeed? What did women in your family view breastfeeding as? And was it common that the people in your circle did this?
No, growing up, I never saw it, never heard anything about it. And then when I went on to breastfeed myself, that's why I think it was foreign to the women in my family because my aunts and my mom and my grandma and those people, cousins, I don't think any of those breastfed, especially not exclusively.
Wow. Speak on that a little bit because I know evolutionarily that humans feed off of breast milk, right? And so at what point in history of time did this change where you initially had all these women breastfeeding, centuries ago, and then you get to a place where there are generations of women who are not actively breastfeeding their children? What was that change in history?
I believe it happened whenever formula began to be marketed. Formula first came about. It was kind of like the next best thing since sliced bread. And it started to become almost a stigma to breastfeed because it's almost like, well, if you can afford formula, that's what you do. Like that's the civilized thing to do. You're going to buy formula. And then also women going into the workforce just made formula feeding become very normalized. It started to become a time where it was like you only breastfed if you were a hippie or you were poor. I think that there's a whole generation of people who not that many were breastfed because there was a whole generation where it wasn't common at all. And most people didn't know the health benefits of breastfeeding. And we thought that it was the same thing and it was just as good. And we've come full circle now to where we now know there are so many lifelong health benefits for moms and babies and how important it really truly is. So it's just taken some time for that to come full circle.
Do you find that it is changing and that a lot of your clients have done the work in terms of researching the benefits of breastfeeding on their own? Or do you notice that it's still a specific type of person or it is a specific community? What are your observations when you look at the women who are breastfeeding right now?
There's still a lot of disparities in breastfeeding, especially amongst women of color. We know that those statistics show that we are breastfeeding at lower rates. And a lot of it, I think, boils down to education, not like level of education, but just getting that knowledge. I think that it starts prenatally because a lot of times when you hear of the issues and the problems that they happen postpartum, right? I'm starting to see that help increase the rates of people, and at least initiating breastfeeding, is having some prenatal education and kind of establishing, at least having taken a class, even maybe having one-on-one consult prenatally. Because what happens is, for example, when I work in the hospital, every day, every room almost that you go into, you go in, they say, hey, how's breastfeeding going? They say, I'm not producing any milk. It's
Mm.
just like time and time and time again. With some prenatal education, then that dilemma, that main problem, that main worry that most women have, they know that, okay, if there is a problem later on, there should be that initial colostrum that gets you through those first few days.
Mm.
And to know what the red flags are if something is not going well.
What exactly is the human benefit of breastfeeding your child, and why should most women consider doing this postpartum?
For babies, we find that babies have lower risks of asthma, allergies, diabetes, ear infections, just all types of illnesses. As far as for mothers, we have lower incidences of ovarian cancer, cardiovascular disease, breast cancer. We all know someone who's been affected by breast cancer. The longer you breastfeed, the lower the risk. And that can be combined amongst multiple children. So if you breastfed one child for this amount of time and then the next child for, even if it's a short period of time, that adds up and together it continues to lower the risk.
Who is at risk of really having breastfeeding troubles, and who is a great candidate for breastfeeding if there's such a thing to describe? And how do you screen for those things when a woman is pregnant? I always share my story about how after I delivered my child, I was unable to breastfeed. And really, initially, I thought it was something that I was doing wrong. And then I found out that I actually had a condition where my glands just did not grow. And I feel
Mhm.
that if I had known this maybe during my pregnancy, I would have maybe moved accordingly, or I wouldn't have struggled so long.
So I feel like for the most part that everyone is a candidate to breastfeed in at least some capacity. And I feel that being set up to kind of go into that knowingly, for example, what you went through, that was, I'm sure, in some ways traumatic because you go in, you had the knowledge,
Mhm.
you knew everything, and you did all the right things. And for some reason, it did not work well. We can screen for some things prenatally. We know that risk factors for not having adequate milk supply or like I'm having thyroid issues, having PCOS, not always, but sometimes. Breast surgery, implants or reduction, breast growth. We have to look at like, did your breast change? That's a very important thing that we look at prenatally. Did they change whenever you got pregnant? Did they get fuller? Did they get tender? Did you get breast changes? Because if not, that's a sign that hormonally something isn't right. If breasts are widely spaced apart and there's not a lot of tissue there, if you can put your fist in between your breasts, if one is a lot larger than the other one, those are all signs that hormonally there's something not going appropriately there.
Mhm.
And knowing those things prenatally, sometimes there are things that we can do to intervene to kind of at least maximize the milk supply that can be achieved. Look at the fact that it is also a personal decision, right?
Mm.
And everybody isn't the same. And what you may decide, no, I'm going to do this no matter what, even if I'm only making an ounce a day or 15 milliliters a day or something. The other people might feel like, no, this is too much for me and it's not good for me. It's not good for me in my life. It's not good for my mental health. I always support whatever the mom wants. And that can change and that can evolve. So sometimes we start out and we're doing all the things, no matter what. But then we may come to a point where it's like, okay, this is too much. Let's try this instead. Or how does this feel for you? Let's try it this way. Or even if they come to a point where they want to stop, I support them through that journey as well. I've never wanted to just push and push and push someone to do something if it's not working for them.
I'm glad you say that because I think women put a lot of pressure on each other and on themselves, right? And so a lot of women are scared to say, hey, I just don't want to breastfeed. And so I'm really happy that your approach when you talk to a woman in the prenatal period, that you're having these discussions and you're making it a personal choice rather than saying, this is what you have to do or this is what you should do. And so I think that's super important in empowering mom to just make her own choices to see if this is what she wants to do.
Absolutely. Because at the end of the day, I'm not there with you 24 hours a day, going through all the ups and downs. And it's definitely a decision that each woman has to make on their own. And my job is just to support you through whatever decision that is. But yeah, I never like to pressure. I just like to inform and I like to just support. I like to support women, especially perinatal women, in more ways than just feeding, because it's a time where you need to be held.
And I think that probably also stems just from your relationship with breastfeeding and your children and being a mom. And so you remember how it was and you remember the support or the lack of support that you may have had. And so you take a different approach because you realize that like this is a really critical period of time. And for a lot of women, breastfeeding can, or the challenges that breastfeeding can come with, can really lead to significant depression or just perinatal mental health disorders, all from just the perceived failure of not succeeding in breastfeeding. So kudos to you for taking that approach.
I feel like a lot of times when I go to a home visit, it's even before I can do anything to do with breastfeeding, I can see immediately that it's like mental health first aid.
Hmm.
I go to a home visit oftentimes and it's like, okay, I can tell nobody's gotten any sleep here. Nobody's taking
Hmm.
showers. Like nobody's done anything and their nerves are shot. So it's like, okay, let's talk about what's going on and let's try to see what we can come up with to make things a little bit easier for you and help you be able to get some rest so that you can continue to cope and then go from there because you're going to reach a point where you just break if we don't do some of that mental health first aid and do certain things to help with coping and to help feel supported.
And I mean, that lack of sleep affects your milk supply, you know. So I remember being in the hospital just after delivering birth and literally pumping every hour because you made a comment earlier and you said that when you go room to room visiting different patients and the first complaint they have is that they're not getting milk. And
Mhm.
I think that having that conversation beforehand, like you said,
Yeah.
would help because I found myself literally not sleeping. And every hour I was pumping and like there's nothing coming out. And here I am, a physician, and I am literally killing myself. I'm not
Yeah.
sleeping, trying to get one drop of milk in this bottle. And nobody's telling me any different because there's just not that guidance. And so then my sleep is affected, then my mood is affected. And then it's like this vicious cycle where then my milk is also affected.
I think we see TikTok and we see the freezers full of milk, and I feel like that's detrimental to mental
Mm.
health because I feel like we have this unrealistic expectation of what breastfeeding should look like, especially those first early days, hours and days.
If you are seeing a mom struggle right after giving birth, what do you want to say just to encourage them as they're going through their breastfeeding journey? What are some tips that could be useful for them?
Lots and lots of skin to skin is always beneficial. It helps with bonding. It helps with milk supply. Hand expression. That's something I even promote to do prenatally, if possible, if it's okay by their provider around like 37 weeks.
Mm.
A lot of times the babies won't latch. It's not that they won't or they don't want to, it's that they can't. So a lot of babies sometimes from birth, just from how they were in utero, sometimes they're just tired. Sometimes
Mm.
they had a traumatic birth. Sometimes they have oral restrictions. There's so many things that interfere with a baby getting to the breast. In those early hours, it's like it's not an emergency that they be. We're gonna look for those cues and we're gonna try to latch. But if the baby doesn't latch, we're gonna try hand expression and we're gonna feed that because even just drops of colostrum will stabilize their blood sugar and kind of count as a feeding. And
Mm.
then we can keep trying, get that hands-on support, get support by your nurse, ask to see lactation, and just keep practicing, but try not to panic. But it's normal that they don't, it's normal that they may not do it right away. Like they're alert for about an hour or two. After that, they're super drowsy again. That lasts for like a day.
That's good to know because I think that there's a lot of pressure also from the hospital to feed this baby, right? And so
Mhm.
knowing that baby has some time to wait is really encouraging. And what happens if the hospital is worried about baby's feeding and they want to give the baby formula? How does a mom sort of navigate those challenges within the hospital? Because I know this is something that comes up a lot. It came up with myself. It comes up with a lot of my patients. How do you navigate the conversations around initiating formula in the hospital when you know baby has barely even been here for that long?
So a lot of the push for formula in the hospital is unwarranted. If there's not a medical indication, like the baby's got a low blood sugar, jaundice, sometimes it's an indication for supplementation. But we always want to think if we're going to supplement, we want to try to supplement with mom's milk if we can, if it's available. And then
Mm.
secondary, we would be donor milk if donor milk is available. And sometimes at a lot of hospitals, donor milk is available and they may not tell you that. Donor milk can sometimes be an option. The baby's either gone 24 hours, has had no wet, no dirty diapers, that would
Mm.
be a red flag. If the baby loses too much weight, more than 10% of their birth weight. But we also have to keep in mind that babies lose that weight in the beginning, and a lot of it is fluid. Moms get IV fluid in labor. Babies get that fluid too. So when they come out, they have one wet diaper. They've already lost ounces, because
Mm.
they're puffed up full of fluid just the same as mom is. So unless there's those red flags and they're just saying, oh, the baby needs to eat because it's been an hour, 3 hours, whatever, that's not a reason to supplement because they're not, the baby doesn't starve in a day.
Mm.
They have, you have time, we have time. And then once you give the baby the bottle, it's a slippery slope because once they get that easy, immediate gratification, a lot of times they'll overfeed for one thing. Cause if they do take the formula, it should only just be a little bit, but they'll give the baby maybe an ounce and they're, stretch out that little tiny belly and then they get that full fill and they expect that. You don't have that. Nobody does. And then it's the slippery slope of just continue to give bottles and that can be problematic. So if we supplement, whether it's a medical reason or not, I would always recommend to start pumping anytime a bottle is given because that's going to help protect and promote milk supply.
That's really good advice for our listeners who did not hear that. A lot of the push for formula may be unwarranted. And so really empower yourself in asking the questions. Well, why does my baby need the formula? Does she or he have one of these things? Is there a medical reason that we're worried about that? And have a conversation with your provider so that you may understand why this is needed. And if there really isn't a place, really advocate for yourself and your baby to respect that breastfeeding relationship. I want to move on to some of the challenges that women face and how to really navigate those difficult times without giving up. Once you get through that initial couple days in the hospital and you're discharged at home, then it's like the hard part starts, right? There is no lactation consultant in the house. There isn't the hospital, the nursing support, the pediatric support. Now you're at home by yourself. And it's in the wee hours of the night, and baby's doing all sorts of crazy things. They may be like latching and unlatching, latching and unlatching, not feeding. Like, how do you navigate these difficult times in the middle of the night when the support system is not there? And how do you not give up?
In the middle of the night, the idea of motherhood and the reality of motherhood, they're like completely different.
Facts.
So once the baby's born, you're like, who's child? Like what? Like they're crying. Like,
Mhm.
why are they crying? I've done everything. And that can be a very difficult transition, I think, regardless of feeding. And feeding can add another layer. But my thing with breastfeeding, I used to encourage is most of the time it's hard at first, right? But in the long run, it gets easier. So it's hard when you're just getting started, but then as you get the hang of it and you get to your groove and your milk volume increases and you establish a full milk supply and you're comfortable and you're confident with latching, then it's easy. It becomes to a point where it's second nature. You're walking around,
Mhm.
you're eating a sandwich and talking on the phone and feeding the baby. But versus, in the beginning where you feel like you need my hands, your hands, you need me standing
Mhm.
over you and we're doing all these things just to get the baby to latch. And so just knowing that it does get easier, being patient with yourself and your baby. If you and your partner went and took ballroom dance lessons, you'd be stepping all over each other's toes. It'd be like a whole mess, right? But once you took a few lessons, you'd probably be like, okay, like you'd be like spinning around like, oh, we can be on Dancing with the Stars,
Mm.
So it's like that. Breastfeeding's natural, but it's not natural like breathing. It's natural like walking
Like
or
walking.
riding a bike. And
Mhm.
so it just takes a lot of practice and a lot of patience. I try to give them tools for like giving them good resources for like demonstrations of technique latching because you kind of forget, sometimes it's in the hospital or at home or when I'm with you, they're like, why does the baby feed well whenever you're here?
Mhm.
But like a lot of times it's like the hand placement or the position of the baby, just little things because I can help a mom who's had 3 or 4 children and I can go in the room and I'll be like, hey, how's breastfeeding going? And I'll be like, oh, I'm fine, I'm good, I don't need anything, basically be gone. So and I'll be like, okay, well, just let me know if you need anything. And the next day I'll come back and they'll be like, oh my gosh, my nipples are so sore. And I'll say, can I just see you feed? And can I just see what you're doing when you feed? And I'll just watch them feed. And I'm like, can I just move the baby a little bit this way and just move,
Mm.
move your hand, do this. And I'm like, oh my gosh, that's so much better. And it's little, like the little things make a big difference as far as like the comfort and the technique and the positioning and those things but do become second nature. But those first few days and that first maybe a week or so, it can be hard. It can be very challenging, but persevering, getting help. Most people have access to lactation even through their insurance. If they don't have that, then a lot of times they have access at least to like a peer counselor or something like that through WIC. So utilize, tap into your resources so that you can feel supported, you can get the hands-on help while you can, because the earlier the better. If it's not going well, the earlier you can get help, the better off your milk supply is going to be in the long term.
Sounds like if you have a desire to breastfeed your kid, one, try to see a lactation specialist beforehand. If you have now birthed your child and you're going at home, try to really still maintain that relationship because you never know when it's a rainy day. If you had to share one inspiring story for our listeners where you have helped somebody come out of a dark place in terms of their breastfeeding, or you've helped them improve their breastfeeding journey, would you be able to share that with us?
Sure. I had a young mom. I had met her when she had her first baby, and she was just young and wide-eyed and bright-eyed and, just a cute new mom, young mom. And I guess she started out, she was not really she wasn't really breastfeeding. So when I checked on her, she was just like, I don't think I'm producing. No, she didn't know if she's gonna do it or not. And she was giving a lot of formula. She was mainly giving formula. But when I went in there and I helped her, hands-on with breastfeeding and the baby latched, it was just like I could just tell that it clicked. And she was like, the fact that I just believed that I could do it, that she could do it, it's like it made her believe that she could do it. And she's like,
Mm.
really? You think I can do this? Like, of course you can. Like, why not? Keep it up. So long, in the long run, that mom who had that baby, it was just a blink, just a day, and didn't really ever think anything about it again. Years later, just like in recent months, came back, had another baby, and in between that had twins.
Wow.
And then it came
Wow.
back, had another baby. And I didn't recognize her because she's, it's been a few years. Her hair is, everything was different. I didn't, you look different when you first have your baby. I
Mm.
didn't recognize her, but she recognized me. And whenever I went in there and she told me that she remembered me, and then I could see it all right there. I'll play before my eyes. I thought that was amazing because I feel like our interaction the first time, and especially her being a young Black mom, and seeing me who looked like her, help her, that changed the trajectory for her and her kids. And
Mm.
she breastfed all those children, including the one she most recently had. So altogether, that's 4 children. And
Wow.
I feel like had our paths not ever crossed, she was just like, I would say at least half of the moms that we see on the hospital floor. A lot of times they start out rocky. They start out, just giving tons of formula, and a lot of times go home not really breastfeeding. Well, for her, that changed due to our interaction. And she went
Mm.
on to breastfeed 4 children. Like, I feel like that is amazing. And it just
Wow.
shows how if you can get the right help at the right time, that it can change the trajectory of your whole experience when it comes to feeding and motherhood.
Wow. I love that. Just the impact that you had on her other additional kids, right? And knowing that she had your support, that initial time really impacted the next few children that she had. And so kudos to you and for the work that you and many other lactation consultants are doing because I think that a lot of people may not understand the impact until they go through motherhood. And so I think it's really important for us to have this conversation, especially if there's somebody out there who may not have that first kid yet, right? Maybe they're thinking about it. Maybe they're pregnant right now, or maybe they just literally had their child. You won't really understand the impact if you haven't heard about a lactation specialist, if you haven't seen one, if you have no one who's used one or family who breastfeed, you won't really understand. And so it's super important to have these discussions to just encourage women, empower women to ask for a lactation specialist in the hospital, empower women to use lactation consultants at home. You said something earlier that insurance covers for lactation consultants. And so you can use your insurance for this. This is a service that a lot of insurances do provide for mothers. I want to ask you, Leslie, to just give three pieces of advice for our moms who are listening right now on the phone and just to send us off as we wrap up this episode.
Number one, skin to skin fixes everything except for flat nipples and tongue ties. And then I'll say that prenatal education is super, super important. And then don't quit on a hard day. If it's important to you and it's something that you know is important to you, then I always say if you're having a hard day, say, okay, I'm going to get through today. And I promise you the next day is probably going to be easier. So I always just say if you're going to stop, don't stop on your hardest day. Try to give it one more day.
That is awesome advice for sure, because it is easy to quit when things are hard, but giving it one more day, the next day may be different. Thank you so much, Leslie. And if our audience is looking for a lactation consultant and they are in the Atlanta area, where can they find you? How do they find you? Give us some information.
You can find me on my website. It's www.mothernurtureatl.com. And I'm on Instagram as well. And my handle is Mother Nurture ATL.
Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.